well as marriage and family therapy. Just so everybody knows, we are starting to record, just so you're aware. I'm a part of the Links Incorporated and have been for several years. The Links Incorporated is a international not-for-profit corporation established in 1946. We have 16,000 professional women of African descent. We have 292 chapters located in 41 states, the District of Columbia, the Commonwealth of the Bahamas, and the United Kingdom. We are one of the oldest and largest volunteer service organizations. We are all extraordinary women who are committed to enriching, sustaining, and ensuring the cultural and economic survival of African American persons. Currently, we have this outstanding programming of the Links. We incorporate 5 facets. We work with services to youth, the arts, national trends and services, which is and international trends and services, which who is hosting this tonight, and health and human services. And the programs are implemented through strategies such as public information, like tonight, education. We do economic development and public policy campaigns. We try to make sure that we are a voice within the community so that we can help our community. That's a little bit about the Links Incorporated. I'm going to go ahead now and introduce our panelists. I'm sorry. Oh, I'm sorry. Somebody had a question. Okay, and as always, ladies first. If I'm saying anything incorrectly, please don't hesitate to say something. I want to make sure that I'm getting things correct. Haja Fofana. Haja. I want to say Haja for some reason. I don't know why. Thank you. Currently, she works for nonprofit Prevent Ed as a full-time counselor and has for the last several years, as well as a group counselor for the Fairmont Behavioral Healthcare System in Philadelphia. She currently holds her master's degree in clinical counseling with an emphasis in marriage and family therapy from Webster University. And I understand we have some Webster people online. I do work with Webster and I've had great success with them. So they have a wonderful program. She is a certified QMHP, as well as having certifications in CPI, psychological first aid, behavioral interventions, and Missouri, Pennsylvania child abuse and neglect clearance. With her experience in case management, with a history of working with individuals and families, she shares a passion for social services, clinical research, crisis intervention, and family therapy. Her goal is a strong community tied with different professionals in the field in order to provide patients and clients with top services. Ms. Fofana loves working with children, teens, families, and adults from a diverse multicultural background. She believes in creating a safe and healthy place for patients and clients who will foster and shape fulfilling lifestyles for each individual to work through. She strives to help patients create and gain insight of telling their story that can lead to new realities. She utilizes various therapeutic approaches, including cognitive behavioral therapy, person-centered therapy. She enjoys her work and deeply respects the therapeutic relationship with her patients and clients.
Oh, thank you so much for that lovely introduction, Claudine.
Thank you. And of course, next I have Mr. Redditt Hudson. Mr. Redditt Hudson is the co-founder of the National Coalition of Law Enforcement Officers for Justice Reform and Accountability. He has extensive background working with the St. Louis Circuit Attorney's Office, Diversion and Alternative Sentencing, the National Coalition of Law Enforcement Officers for Justice Reform and Accountability, the Urban League of Metropolitan St. Louis, Vice President of Civil Rights and Advocacy, the NAACP National Staff, and the American Civil Liberties Union. And Mr. Hudson, was there anything else you would like to add?
Oh, thank you. I'm looking forward to our conversation.
Okay. All righty, so we'll go ahead and just kind of jump right in. Let's see. And we'll start out with just a basic question. What are some of the key signs of substance abuse in youth? What I'll do is I'm just going to start with the questions, and then both of you can kind of start from different perspectives, just so that everybody listening can kind of get some idea. Once again, that question is, what are some of the key signs of substance abuse substance abuse in youth?
Do you want to go first?
No, ladies first. I
I'm
like
sorry.
that
How do
role.
I pronounce your name? I am so
It's
terrible with names.
it's Reddit. Like the
Reddit.
website Reddit, it only has 2 T's instead of 1. And if I would have put 1 T instead, maybe they would have paid me for my name. But it's pronounced Reddit.
Okay.
It used to be
Yeah.
my grandmother's maiden name. Yeah.
Oh, okay, Reddit.
Yeah.
I will try my best. I'm so horrible with
That's
names.
okay. That's all right.
I would firstly like to say from a clinical standpoint, to look at some key point or key factor that, can contribute, that would be, behavioral and physical sign. A lot of time with adolescents, when you are looking at behavioral sign, you have to be very careful because it can come across as, typical teenage behavior, such as they just rebelling. But if you are going to assess, you want to look at both of them, behavior and physical sign as well. So behavioral sign can come in a sense of emotional instability. The child might lose interest in their favorite activity at time. Their level of sadness might be intense. They might be irritable. There might be anger as well as aggressions. Just to give a little bit example of that. On the other hand, the physical attribute can be, you might notice some bloodshot eyes or some watery eyes. Sometimes the child might have runny nose or frequent nosebleed. The thing that mostly stand out to some parents will be some weight loss or some weight gain.
To preside over the respective houses of Parliament.
I'm sorry, what?
So congratulate members who have been elected to parliamentary leadership
If
positions.
somebody got in on our
Yeah, somehow somebody got in. Could you mute everybody except this for them? Thank you. Please go ahead. I'm sorry for the interruption.
Okay, can you guys hear me, Carol? Can you guys hear me? Yes.
I'm sorry, I muted myself. Yes, I can hear you.
Technology, right? Yeah, so just pretty much you want to look at some behavior and physical sign, as I have given some example of that. And I will touch in on some weight loss or some weight gain. Sometimes that can be some signs that can kind of factor to substance abuse. And sometimes some parents might notice the poor hygiene or just simple things such as the child appearances, right? How they keeping up with their looks sometime. They might have increase or decrease in their appetite, just wearing inappropriate clothing. In the summertime, they might be wearing hoodie or sweater, even though recent study has shown why kids wear hoodie, in the summertime. So those are different things that you kind of look at. And then we are also looking at dependency, meaning that, how dependent are they on the substance too. So those can be some key signs to substance abuse in adolescent.
Okay, Mr. Hudson. And I'll bring back the question again. I'm sorry. What are some of the key signs of substance abuse in youth? Oh, you're still muted.
Can you hear me now?
Yes,
Can you hear me?
Yes.
Okay. I would agree with everything that the prior panelists just said. And then add from the perspective of just being a parent here where, I've raised my kids here. I'm working on my first grandkid. The things that I've seen with friends and peers and families who've experienced crisis like this. First, you start with a baseline of just knowing your kid, right? You know when behavior changes, when something is off. Trust your instincts, and you can look for things that are a little bit more concrete, like they begin to frequently ask for money, much more than they have in the past. I mean, teenagers and adolescents always are asking for money, but there's a difference between asking for money for the occasional event or something and just this regular drumbeat. If I need some money, I need some money. If a child begins to steal, not necessarily from you, but from other places. It could be a sign that they are trying to find ways to make money to support a habit. I heard the prior panelists say relative to some emotional responses, you definitely want to look for a kid that's starting to isolate him or herself from activities that they normally enjoyed, from people that they normally enjoyed, and they start withdrawing into themselves. It could be anything. It doesn't necessarily have to be drugs, but certainly that would be something to pay attention to. It could potentially be a red flag. Breaking curfew is another one. If there's an assigned time that you have for your kid, you know, your kid knows that they're supposed to be in the house by 9, 8, 9, 10, whatever it is, and they start coming in at midnight without much explanation or some haphazard explanation, that could be a red flag. Avoiding eye contact. They won't look at you, to the prior panelist's point, because their eyes, you know, their pupils may be dilated, their eyes may be red, or, you know, they may not be able to focus. Just behavioral changes I would pay attention to, and knowing your kid. That's why communication is so important. Regular communication with our kids so that we do sense and see when there's a change in behavior or attitude or their disposition changes. All of those things could potentially indicate, they don't have to indicate that, because adolescence is already a challenging time. It produces all kinds of different behaviors anyway. What I'm saying is, if you notice some of those kinds of things, you may want to look a little deeper into the situation and see what's going on.
Thank you. That was very good from both of you. The next question are, what are the top 3 factors influencing substance use and abuse in youth?
You want me to go first this time?
Oh, I was hearing the noise. I could.
I did.
Yeah,
I did
you
hear
can
that.
go.
I'll say it again. The question was, what are the top 3 factors influencing substance use and abuse in youth? I know that there's the changes throughout the times, but
Yeah,
talk a little bit about that.
I can jump on that, but then I'll speak from my experience, because I used to be a police officer. Just to be clear, I was a police officer here in St. Louis City for 5 years prior to beginning other work that was also criminal justice related. And from what I saw in law enforcement, from what I've seen in life, like you say, some things change, but some things don't. I would say if I was identifying the top 3, or, you know, 3 of the top 10 things that really influence kids to begin making choices about using drugs, peers is high on the list. Your peers. Peer pressure is a constant, especially in adolescence. You know, you see your peers doing it. You want to be in with that crowd. You don't want to be seen as an outsider. You don't want to be seen as not part of the group. And so sometimes if a young person is not as confident, or even if they are confident, they could fall prey to peer pressure, because you just want to fit in. I like these people. I want to do what they're doing. That's one. Media and social media. I'm talking about mass media, television, social media, TikToks, Instagrams, all of those. Unfortunately, often drugs and drug life is glamorized to our young people in this country and made to look like something you really want to be a part of. There's a lot of money associated with it. There's good times. You feel good, and all of these things can, you know, convince a young person, unfortunately, that that's the case and I need to be a part of that. And the sad reality is the drug life is nothing like that at all. It ends badly in most cases, unless you get some treatment, some help, and some support. You know, we could have did a whole podcast on why the drug life itself is something you want to avoid. It's not like what you see on television. And the last one I would add to that is family exposure. If they have an older sibling or someone who has experimented with drugs, if they have a parent even, or a relative that they've seen experiment with drugs, or they know is using drugs, that kind of exposure, that kind of sense of, okay, well, they tried it, maybe I want to try it, can easily come into play. We see that with alcohol too. Kids in America that grew up with an alcoholic parent, are much more likely to become alcoholics themselves because of the exposure they had in their developmental years. So I would say those things: peers and peer pressure, media, social media, and family exposure would be very high on the list if I was trying to identify things that could potentially steer a kid towards using drugs.
For me, this question is very hard to just pick three.
Yeah.
Always already touched on some of the things that I was thinking of myself. As a counselor, the term that we sometimes use in psychology will be, for me, it will be the primary reason why it will influence substance abuse or substance use. It will be self-medicating. The term that we use is self-medicating. This come in a form of masking some type of emotional pain, right? It could be escape from distress feelings or complicated relationship, whatever that dynamic might be in a family or outside of the family. Sometimes you also might see that some kids are just curious. They want to experiment. They just want to see what the substance look like, especially with marijuana that is very popular among adolescents. And some kids are also just risk taker, right? They want to feel more independent. They want to make some decisions in their life. They feel like they are being treated as a child. So sometimes you do kind of see that too. Most of the time, especially when I do work with kids from middle school to high school, sometimes the substance abuse might come in the form of academic performances, for example, like using Adderall, that increase the energy, right? Because it's a stimulant. Sometimes kids might use that to just perform better in school, or even something simple as, they playing sport. Maybe they want to be the captain or something like that. So sometimes those could be some influences as well. So right now we are in a digital world. Social media is absolutely big right now. Everybody want to be an influencer. Everybody want to be a TikToker or YouTuber, right? Consciously or unconsciously, these messages are being mainstreamed in movies and shows and different things like that. When we look at vapings and stuff, so social media definitely would be one of my top three as well, as Redditt already mentions, because kids will see it, they want to be like their actor or influencer. The message could be conscious or unconsciously too. So those can be some factor that can contribute to youth or adolescent substance use or abuse.
Thank you. Just in case there's everything they've mentioned are all different things that get involved with substance abuse. If you go to the CDC, they also talk about family history of substance abuse, family rejection of sexual orientation or gender identity, lack of connectedness to their families, parental substance abuse or use, and favorable parental attitudes toward the behavior. And for several years, a lot of things have happened with trauma. A lot of trauma can lead to substance abuse. Obviously, currently what's going on with COVID and with a lot of what's happening with probably we've not been able to focus on a lot of the families and interventions that were taking place before COVID, and being able to kind of be more invested has caused a lot of traumas that have led to substance abuse with young people. So I would be remiss as a trauma therapist if I didn't mention trauma. My universe,
Yeah.
what can I say?
No, that's right.
Yeah.
Yeah.
It's difficult to answer that question because when you said top three, it's really not definite, right? It's more that kind of listed kind of go into that can be a factor or influence of substance use or abuse. So
yeah, there are so many different things. Yeah, you're right. It's hard to say just top three, but there's so much going on, unfortunately, in the world today. Not all is good. With all the good things that are happening, there's some really bad things that are happening as well. Thank you. Okay, so this is another one. From a legal perspective, what are the risks and consequences associated with youth and substance abuse?
There are serious risks. Go ahead.
No, I want to hear from your perspective Honestly, especially being a former police officer, I would definitely
Well,
learn more
they're very
the
serious.
legal versus a counselor on that. Yeah.
They're very serious risks legally and physically associated with drug use, but legally for sure, there's criminal exposure, right? If you get caught with drugs in this country, you're likely to be charged and prosecuted. And unfortunately, racism in America is real. I'm here as a witness to tell you I've been here for 57 years. It is very, very real. And it is most often reflected in our criminal justice process. That's why you can watch somebody at the highest level commit crimes all day long in broad daylight and still be running around out here talking free. And somebody like you or me or one of our children get caught with substance in his pocket or in his car and be calling you from the jail. So legal exposure is very serious. When you get involved with drugs, you can be criminally charged, but can alter the course of your entire life. A felony drug conviction can change the course of your life in terms of employment, in terms of education, in terms of any number of opportunities that you otherwise might have had with your natural gifts and talents and your natural abilities. Those things can be taken away from you because you got caught with a certain amount of this substance or that substance. Now, I know there's a contradiction in that to the extent that marijuana, which is one of the most popular, not the most popular drug with kids in America, is legal in many places in the United States and still criminalized in others. Here in St. Louis, for example, the St. Louis Circuit Attorney that I work for has not made marijuana prosecution necessarily a high priority. And I think some of it is for that reason. If you get caught with less than 100 grams of marijuana in St. Louis, you're not as likely to be prosecuted if you get caught with more than that. Other substances, though, which are prevalent now, fentanyl is at the top of my mind. It's a very dangerous drug. I hope we talk about that a little bit over the course of this evening, because there's such a massive exposure to folks in St. Louis to that drug because it's in everything. Heroin is another one. Cocaine is another one. You get caught with any of those substances and you're going to get a felony charge. And a felony charge, if you're 18 or older, is definitely going to alter the trajectory of your life. So it's a very dangerous game to play in terms of your future, legally and physically as well, in terms of your actual health, whether you survive or not. So it's nothing to play with. And yeah, I would put a major emphasis on the fact that there is criminal exposure for folks who possess drugs or sell drugs or use drugs.
I will like to thank you for mentioning that when it comes to legal and law, race and ethnicity definitely.
Oh man, I can't overstate it. Listen to me. This is just me talking. I cannot overstate.
Yeah.
I cannot overstate the difference. And our circuit attorney is working to address that. You have in St. Louis City, you have a circuit attorney who campaigned on the fact that our criminal justice system in the United States is institutionally racist. That's just a fact. So you have someone here who recognizes that, but because it is so deeply entrenched, all the remedies that our office is trying to put in place to address that do not necessarily provide a buffer to exposure to a system as it's existed for hundreds of years in this country. So be mindful.
Yeah, I definitely see that in my sessions. I do work with probation and parole board. And I also work with the diversions program, that just pretty much giving people a second chance for lesser charges, just to sponge stuff out of somebody's records. So I do like that new system.
That's
I'm pretty sure you're familiar with that.
That's where I am.
Oh, okay.
I am the diversion program. Me and an attorney and Anastasia Wright, Jamie Myers is the attorney, the three of us, and Victor Ali or the diversion.
You guys are doing amazing, especially when it comes to race and ethnicity.
Right.
Giving somebody a second chance. Just to go off a little bit about some of the things you kind of mentioned, I always tell my adolescents, record matter, right? Things that you do in adolescence can definitely follow you to adulthood. You already mentioned things like, getting a house, getting car, just something so simple as employment or getting appointment can definitely be affected, right? But those records can follow you for a long time. And then we are also looking at delinquent behavior, right? In the sense of the person might do home evasions. We see that as a form of burglary. And you also have to mention, violent behavior with adolescents, because when they are under the influence, they are not coherent. Unfortunately, there will be a time assault charges they might have, likely of being arrested because they are selling or distributing the substance itself. They might have a DJO. I call that a baby probation officer. That's what I call them sometimes. Sometimes we also see it in the form of the child or adolescent might be part of a gang member, or they might drug traffic. And sometimes we definitely do see prostitution too, side of a legal form when it comes to substance and some consequences that kind of associated with that. And we cannot forget when it comes to alcohol consumptions or any other substance, right? The fatalities that go with that. And driving under the influence, DUI, DWR, whatever term you want to use, that is huge, because not only will it affect you, but it also will affect other person in the community too. God forbid something happen due to accident, the person might die. You're looking at manslaughter, you're looking at different, different type of legal charges and felonies and stuff like that. So those are things to kind of touch based on when it comes to legal perspective of substance use.
One more. You made me think of something very important. I'm glad you said it the way that you did. Something to understand. And I told my own kids and other people's kids this as we were raising them, especially, our young men, but our young women too. Your children need to understand this very, very clearly. They need to pay attention to who they're with.
Yes.
Who they're with. Even your kid doesn't have any drugs on him. If your kid gets in a car with his cousin or his buddy or his friend, and his buddy's cousin is in the car with them, and his buddy's cousin has a gun and some drugs on him, and there's 4 of them in the car, and they get pulled over, and the police get up to the car and they find the drugs and the gun, and nobody claims the drugs or the gun, guess who gets the drugs and the gun? Everybody.
Exactly.
Everybody. The police officer won't make a distinction, and he doesn't have to. He's got himself now 4 felony arrests. He'll let the courts sort it out. He'll let the lawyers and the judges figure out who was what. But in this moment, at this scene, while my lights are on, red flashing, and it's a gun and some drugs in here, and nobody knows who it belongs to all 4 of you. All of you put these handcuffs on and come with us. Your kids need to be very mindful of who they're around and who they expose themselves to. And drugs and guns, unfortunately, are often in the same place. If you're dealing with a young person, not necessarily your own kid, but say your kid is around somebody that's using drugs or selling drugs frequently, a lot of times guns make their way into those spaces to protect money and drugs.
Absolutely. Yeah.
Thank you. I wanted to make sure that there was a quick thing before we go on to the next thing of what kind of drugs we're looking at, just so you have an idea. There are several different drugs, obviously, that teens use, but the most common right now are marijuana, which we just mentioned before, cocaine, stimulants, which are can be ADHD medications. Adderall abuse is very high among teens. Painkillers and prescription drugs, whether it's being diagnosed for them to be using or if they're taking from other people. So Vicodin, Oxycontin, those kind of drugs, as well as Spice K2, which is a synthetic marijuana, which is kind of sprayed with herbs. It's a little different. It's a little bit stronger than regular marijuana. Obviously, heroin is still out there. Crystal meth is very common, especially in Missouri. MDMA, you would know it better like being called ecstasy or Molly.
Yeah.
And then obviously hallucinogens, which includes drugs like LSD, acid, which is still very common. It's still low. It's mostly among older kids, but it's still very prevalent. DXM, which is cough syrup. It's usually found in cough syrup. It's easier to get their hands on, so it's used by kids as young as in the 8th grade. And then obviously inhalants. This is the easiest of all. This includes such things as glue, nail polish remover, gasoline. This can be specifically the most dangerous because it's, first of all, it's easier to obtain and we don't know the reactions that they'll have or how they'll use it.
Yeah.
And it's also used through the nostrils, right? So it definitely going to affect that pathway up there. When it comes to inhaling, that's something to think about. Even with prescriptions, medication being prescribed medically, it can still be abused. And I always emphasize that for my client too. Just because it's prescribed does not mean people don't tend to abuse their prescriptions.
And let me say this, because you ran off a list there, and it was a pretty comprehensive list, and all of those drugs are available and being used in St. Louis. Apart from the marijuana though, with the cocaine, the methamphetamine, and everything else, unless your kid, has a prescription, as you just alluded to, or is buying something over the counter, those things can be dangerous. But if they're getting their drugs off the street, it's super dangerous. Because we have a felony drug education class at the Circuit Attorney's Office, 4 cohorts a year. Each cohort has 4 classes. We bring in experts, people who are prior drug users who turn counselor, people who are science-based. Everything in St. Louis, according to these experts, almost everything in St. Louis, you are potentially exposing yourself to fentanyl. Fentanyl is one of the most dangerous drugs that there is because it takes so very little to put you in serious risk of death. It doesn't take a lot of fentanyl to kill a person. And there's so much of it in the St. Louis community on the streets that you never know if you bought some cocaine or you bought some crystal meth, if it's some fentanyl in it. So the best plan is prevention and avoidance of those kinds of things, and to be fully aware and let your kids know that that's out there on the street.
Definitely. And to tying in with that, when talking to kids about drugs, a lot of parents have said to me, even in sessions, oh, if you talk to them about it, then they'll make them more obvious to go and use drugs.
Mm-hmm.
Believe me when I say this, as young as grade school, they're being exposed to stuff now that is way different than we could imagine. I have little kids, 11 and 12 years old, who are smoking marijuana outside of school at recess. It's just, it's a different world. So having the conversation earlier, not necessarily in 9th grade and maybe junior high, and having those conversations now is very important. That kind of brings us to the next question. In talking to children about substance abuse, what should parents advise, or what should they say?
The approach I use, I'm one of the counselors that is very important for me to meet my client where they're at. In order to do that, I need to be able to create a safe space for them. So parents can kind of use that same method or technique. And this will come in the form of first, making sure that the parent do their research. So that way they do have factual information they kind of provide while they are having that discussion with their child. Not only are you going to meet your child where they're at, but you also create that safe space, right? And you have to remember to use non-judgmental tools and also use open-ended questions. Most of the time that can kind of open that honest responses a parent will want or looking for. Make sure that you are listening, paying attention to their questions or their concern. This kind of show a little bit how that can lead to a teachable moment between you and the child. Make sure they are the expert, you learning from them. By creating that non-judgmental tool can kind of set the tone for that. And I always tell parents to use terms or terminology that the child uses or is related to or can relate or understand. If you are using something that the child don't understand, it's going to be very hard for you to give that advice that you want. So just have factual information that you can present. Don't have a non-judgmental tone. and just create that safe space and meet them where they're at and let them be the expert and let them educate you. When you are having that discussion, you might ask them that what are the perspective of if they have friends that are using substance, so that way you can learn from them to see what are their thoughts about somebody using substance in order for your question to be asked or your assumptions and curiosity to be asked.
Yeah. I really want to emphasize something you just said, which is beautiful and it's absolutely important. That safe space aspect of talking to your kids, not just about drugs, but about anything.
Right.
You got it. They have to understand that they are loved unconditionally and that you are there to protect them because you love them and you want what's best for them. And if the conversation is based in that, then you can open up to talk about, for sure, how it can impact their health. It's dangerous. Value yourself enough not to put those kinds of toxins in you that could do permanent damage to your body, expose you to criminal sanction, which can affect your entire future. I would just talk to them about what their plans are, what they want to do with their lives, and how we can together support that and move them in a positive direction. And drugs is the kind of thing that can definitely take you off track. I've seen, unfortunately, many young people's futures altered or lost because of their exposure to drugs. Talented people, beautiful people, intelligent people. Nobody is exempt. And here, let me say this too. It doesn't matter what community you live in. You can be in the poorest community. You can be in the richest community. Drug exposure in this country is everywhere. There is no place that you don't need to have these conversations and make your children aware of the choices that are in front of them and support them when they're making the right choices.
Definitely. I think just like Ms. Fofana and both Mr. Hudson said, it's realizing that it's everywhere. It's not necessarily going to only happen because they're having these issues or something like that. We have a lot of kids as well as adults who may just have a predisposition to be able to use. A lot of times, and I say this and parents give me dirty looks when I say it, you have to look at it that sometimes drugs are available and they make them feel better, even though that shouldn't be their coping skill. Mm-hmm. It's an easy coping skill. Mm-hmm. You can go to the store and buy glue and huff glue, or you can try to deal with the conversation you don't want to have. Even as adults, sometimes we tend to pick the drink after work rather than have the conversation with our spouse or our family or the person we don't want to have that conversation with. There's a lot of times that we want to avoid pain, and drugs, even though they cause pain, can also, for the moment, kind of set that pain aside and let's focus on other things. So it's really kind of important to realize when you're talking to the kids and listening to what they're saying and kind of hearing sometimes that they're in pain about what's going on in their lives. Another question that came up, if a child is at the age of 17 or 18, they're not technically a child anymore. What would you advise if they're using drugs? How what would be helpful, or what would you be able to say to them?
The same thing I've lived if it's my own child. I don't care if it's 17, 18, or 30. I'm going to approach them from a place of that unconditional love and try to identify, what's the motivation behind them making the choice to use drugs, and look at how it's impacting their lives. As you said, some people, and that is borderline controversial, but it's also true. Some people have used drugs, quote unquote, successfully and continue to live their lives the way they do. That's not necessarily the majority, but I would talk to my child about their drug use and how we might help them make a better choice and move away from that, knowing that it's easier said than done. Because if you got somebody that is an habitual user, there are physical things now in play, chemical reactions and other things that in some cases an addict, needs a drug to survive for a period of time and not get sick. So there's a whole support conversation that I would have with my kid to identify resources to help that person move past that crisis in their life without being, as the other panelists said, judgmental or anything like that, because anybody can be exposed to this. Nobody is exempt. It doesn't mean that you're a weak person if you become addicted to a drug. It just means that chemically, now that you've exposed yourself to it, that's what your body requires. And so I'm looking for help for my kid at any stage.
Yeah, I totally agree.
For me, when I hear that question, my brain automatically goes to consent to treatment, right? Some parents, some states are different when it comes to consent to treatment. Because you are in the state of Missouri, any child under the age of 18, a parental consent will need in order to start the treatment, right? It could go either way, either the child consenting, the parents are consenting, or both of them is consenting. So that's something to look at. And a lot of time it might be consented treatment in the form of voluntary or involuntary admission. So we also are looking at that. It's weird and complicated when it comes to law. It just all vary and it all different in different states. So that's something to definitely look at. Is my child going to be admitted if they refuse or they don't want to consent to treatment? Because no agency will take anybody with that. They give you like approval to say, yes, I want to be here. I'm seeking help and I need you guys to use your modality of treatment in order for me to get better. But I always tell parents that always create and foster a safe and healthy environment for the child. It just go back to that idea where, meeting the child with the ad, making sure that you're all creating that safe space. As my panelists, I already mentioned, just being there for your child and just making sure that you're not pointing yourself first as I'm the parent, I say so kind of conversations, just make sure that whatever you decide to do is going to be the best interest of your child. So yeah.
Or I'm just talking away. This is kind of a follow-up question that kind of goes along with what we're saying. It's actually in the chat, but I'm going to bring it up now. One of our audience asked, if marijuana is legal in my state, why can't I use it? How do you respond to this question coming from a teenager?
You forever debate. You want to go ahead for the legal side?
Yeah, that's called raising teenagers, man. That's you respond based on how you respond. I mean, I don't think there's a uniform response to that question. It depends on the kid and the circumstances. It's a legitimate question, unfortunately, and it speaks to a disarray in the American criminal justice system. And it's going to, when we see marijuana ultimately become universally legal, is when they figure out how the corporations can make the most money from it. Then it's going to be legal in all 50 states and it'll be no problem. Until then, it's on a case-by-case basis. I'll be honest with you. I don't know how I would answer that question until I'm asked by my own kid, I guess. I don't know how I would answer that question.
Age definitely play a factor. I mean, we are in a neighborhood.
Well, yeah, of course. I mean, yeah, I'm assuming it was a legal age, like 17, 18-year-old kid asking the question. If you were 10 years old, it really is because I said so for me.
Some state, yeah, you're right. Age definitely play a part. And also we have to remember any child that is not, above 25 or below 25, we have to look at brain development, right? Even if it is legal on federal level or state level. So those are the two things that you also have to look at. Regardless if you can purchase. When it comes to marijuana, there is different form. We are looking at CBD. We were looking at different things that might be synthetic, not synthetic. You already touched on to make sure that it's not laced. You have to think about that, right? Because it could be laced with fentanyl, which potent level is very high. For an adolescent or a child brain that is not fully developed, that can definitely play a part. So those are different things that you can kind of have to look at as a parent or as a person. So it just all depends. Is it legal on the federal level? Is it legal on the state level? for some people who are on probation or parole, right? They also have to think about that because federally you on probation or parole, even if Missouri state level legalizing marijuana. I would just look at the science. Me as a counselor, I'm always going to go with the science part, regardless if it's legalized or not.
Definitely. This kind of also ties into another question is, if my child is doing drugs, am I required to report the use or dispose of the substance and seek treatment for the child?
No, you're not required to report the use of your child using drugs. I would seek treatment first. That's my advice to you, and do everything I have at my disposal to work with that child to help him through that crisis. But there's no duty to report. I mean, if that was the case, do you know how many kids would be exposed criminally now? I say it all the time. If we wanted to get a pile of drugs right now, all I would have to do is go over there to Washington University right now as I speak, raid those dorm rooms and have everything dumped out on the commons, and I would have a substantial amount of illicit drugs at my disposal. But those parents are not going to be reporting those kids. They're probably going to try, if they discover that they're using, to get them some help and some counseling and some other resources. And that would be my advice to you.
Yeah. And also reporting, are you processing as in, would the reporting have consequences based on you and your child relationship, or the reporting in a sense, will my child get in trouble, right? When it comes to reporting, it's weird. For example, being a clinician, I am a mandated reporter. So when I am engaged with my clients or assessing them, I have to make sure that their whole environment or their safety is at the top, right? So a lot of time when parents are disclosing their child substance use, I'm also assessing the home environment. Is the parent using themselves? Is the environment safe? Is the environment have substance? So sometimes some parents might have a fear of seeking help because of that. Am I reporting because I'm going to lose custody of my child? Or am I reporting because the relationship dynamic between me and my child going to be messed up or get bad, right? Because those are different level of reporting that you have to also process, me as a counselor, if a family is in my sessions. So it just all depends what type of reporting we'll be talking about and what consequences that come with those.
Yeah. And it just
I took the question to mean, do they need to like turn them into the police or something? And no, you don't.
Oh yeah.
I understand that panelist does have a duty to report because of your position. You're required by law to report. But I'm just saying, as a parent, I don't know that would be my first move to expose my child criminally because they were using drugs.
Yeah. And for the sake of everybody listening, we do have a therapist do have a duty to warn, police have a duty to warn if there's a danger. If a child is in a situation where they're being, unlawfully going to be hurt, if there's going to cause some severe damage to them, we have a duty to warn that. If you have a child who you feel is using marijuana or using alcohol and you want them to receive treatment, we are not necessarily going to turn them in and put them in jail. That's not necessarily always the best route. If they're hurting somebody or using drugs to commit crimes or something like that, that's a different.
Well, that is very different.
Exactly.
Very different situation.
That's different.
But obviously, treatment options, and that kind of falls into what we're talking about yet. Next, if a youth is in need of treatment, what resources in our region would you suggest?
What's some of the things that you use, Redditt?
I think there's any number of drug treatment resources. You can kind of look some of those up. Schools and churches always have referrals to different supporters for drug treatment and counseling. The Black Alcohol and Drug Services is an acronym for BASIC. If you've ever heard of it, it's outstanding. It's the best in the region to me. It's run by Oval Miller, who has a fantastic crew I don't have the address and number right off the top of my head, but it's called Basic.
Not to call you, they are located on South Grand.
Okay, South Grand.
Mhm.
Just that would, if I was in a situation, that would be who I would go to. But there's any number of other treatment places. Hospitals can also refer you to different agencies that provide that kind of support. And like I said, schools do as well. If you talk to a counselor there, you could, yeah. But Basic, the Black Alcohol and Drug Service, is outstanding.
Yeah, good people. For me as a counselor, it just all depends the locations, right? And we also have to look at insurance, not insurance. Locations come in a sense of is the person living in accessible places such as St. Louis City or St. Louis County. We also have to think about rural areas. Sometimes a lot of time resources are not accessible. When we are looking at places like Franklin County or Lincoln County, sometimes those resources are limited. You know, unfortunately, some of the resources is not there. But a lot of time I do direct people to go to starthere.stl.org. I love that website because they have different tabs for different things. It could be for mental health. It could be for domestic violence resources, or it could be something simple as food pantry. So, you know, this website is, you know, community put together where people can access resources. Another place that I do use sometimes is substance abuse and mental health services administrations. That's very big. A lot of counselors know that it's almost like an umbrella for all of us. Or sometimes, you know, parent can put in fronttreatment.org. The reason why I like that website is all you have to do is just put your locations, meaning that you put your zip code and you are able to filter according to like insurance, what type of treatment are you looking for, what age group are you looking for, you know, is it co-occurring, not co-occurring? So those are different things you can also use. We always have to remember when it comes to resources, you know, is it state funded, not state funded? Meaning that is it going to be Medicaid, Medicare, or is it going to be private paid? And a lot of time when it comes to adolescents resources, it tends to be more linear than adult actually. Sometimes it might be based on parents or guardians' income. So that way it's a paying scale, we call it. So those are different things that parent can kind of use. And another thing that I do want to mention here at Prevent Ed, me and my colleague, we have put together a treatment manual. I am going to be sending that to Jeffrey in case anybody need access to that, or you can just email me. I don't mind kind of like emailing it to you, or you can visibly pick it up on our office, which is like a hard copy. In that you will see different type of resources that anybody need according to Illinois or Missouri, the state itself. Just to mention that we also have our program here called Guided. Our program, we kind of look at preventive side of things, meaning that we're catching that early on sign of substance use or substance abuse. And I am one of the counselors that is over that program. So we are in a school, we also are in a community. That program is free of charge. We don't charge for that program for our adolescents. So once again, it's middle school to high school. The child or guardians meet with one of the counselors. We assess them to measure their level of care. It might be that that person just first-time user or second-time user. We enroll them, the child, into the program so that way we can kind of prevent future use. Or sometimes you might just be looking at different alternatives based on, once again, the child level of care. Another thing I do want to kind of mention too, here at Prevent Ed, we do train family, community, parents, how to use Narcan. So Narcan is a life-saving medication that kind of prevent overdose from opioid receptor in the brain. So it, almost like a nasal spray. So we do the training here, and we also provide resources for that too, if anybody is in need of that.
And I just wanted to mention, I know here in Missouri, I know it's a very big thing that a lot of times they want children to go down into immediate programming where they're in a residential facility for long periods of time.
Yeah.
I'll be honest with you, there are programs, they are expensive programs. They help with that child there, but there still has to be a connection with the family and a connection of what's going to happen when they're out of treatment.
Absolutely.
Substance abuse, when you don't have access to it, it's still hard to get over substance abuse, but it's a lot easier than doing 8, 10, 11, 12 months or more of treatment and then putting them into the exact situation that contributed to the use of substance abuse. So it's really important to realize that it's not just going to be a change for the child or even for an adult. It's also going to be a change for how they deal with their family and how their family deals with them.
Thank you for mentioning that. Yeah, continuum of care is definitely important in any type of recovery or abstinence stages.
Yeah, it's very important to remember that it's not just going to be, they're going to go in for a treatment program, be gone for 30 or 60 days, and then they'll never use substances again. Relapse is still very high. And one of the big issues is that a lot of the things that brought them to using substances, trauma and other things like that, is still there. And so those things have to still be addressed as well. I actually have a lot of information and different resources, both for outpatient substance abuse and inpatient programming, as well as therapists. I'm going to make sure I put that in the chat. As far as programming, somebody asked, like, what are the ages? It's usually starting, a lot of the programming starts for ages 12 and up. I'll be honest with you, don't have a lot of programs for 8, 9, 10-year-olds. Obviously, there's a feeling that they should have more control over, parents and our guardians have more control of what's going on with them. That's not always the case.
Recording in progress.
Okay. In reporting your child's substance abuse, what are the ramifications for the family or the parents?
It depends. If it involves some criminal activities, you may have legal exposure, but other than that, I'm not 100% sure what the outcome would be, other than you finding the help that your kid needs. I don't know. Now, there may be some other things that I'm not aware of in terms of status here in the country. If there's some kind of penalties for, legal violations or crimes, I don't know. I'm not really aware of those.
I am going to process this with my counseling brain. If we are talking about parent and child relationship, a lot of time, unfortunately, the consequences might be that the child might run away. If they do run away, they might become homeless. So that is likely that the substance use will increase, right? The child might disengage themselves from family or support system, or once again, just going back to what I mentioned earlier, it might be some violent behavior before the child do leave the home. So those are different things that can be the consequences of that.
So people tend to learn from stories. So I have way too many stories, unfortunately. I had a family that I worked with not too long ago, who they were having substance abuse with the adults. Unfortunately, the kids were having access to a lot of the drugs that were in the house. They felt that they were hiding them well. They were not. The kids were using the drugs, they were using the drugs. And then at one point, it got to a situation where everybody was unfortunately high. And one of the parents, the father, in a sort of hallucinogenic situation, stabbed his child. He lost custody, obviously. He was thrown in jail. Mom was high when she called the police and they came over. And of course, she ended up losing custody and the kid ended up in foster care. I think it's really important to realize that in situations like that, things got out of hand. They got out of hand really fast. The family in itself had some dysfunctional things going on, and the substance abuse was not just the kids. Obviously, he was introduced to the drugs from the family. Even at the time of the stabbing, he didn't have the ability to understand what was happening. He was like, I think, he didn't even realize it was his dad, because he was having his own hallucination situations going on, and he had to be literally brought to a hospital and receive treatment to get him to a point where he could realize what happened. And then when everybody was sober, the reality of our family just exploded. Kind of came up. That's an extreme extreme example. I think it's important, when you think about the consequences of the family, realize that if you have the opportunity now and you see things going on with your kids, be prepared to be ready to hear maybe not so pleasant things about maybe having to look a little bit at what's going on in the house, what's going on around us, how are they viewing some of our things. A lot of parents, I know, we watch a lot of things on TV and stuff like that, and you might have a glass of wine or a bottle of wine, and you don't think about the fact that kids are paying attention to you and thinking, okay, that helps ease stress and everything like that. Maybe if I use this or I use that, it'll help ease my stress. That happens a lot. Not saying that, all parents are running around causing substance abuse. That's not what I'm saying. But there are obviously signs and things that they see. They absorb everything around us. I think it's really important when we think about how the consequences of some of our actions that we don't think about may be brought up, especially in treatment. Even for the kids. It's a really big thing when I work with families, that they say, I don't know why these kids are like that. It's them, or, parents aren't together, it's the other parent, it's not them, it's not me. But realize it's not a judgment, it's not that people are putting you down, but it's more about making sure we help the kids. And sometimes we have to look into the own mirror and kind of figure out, is it better that they get help and they get treatment and that they're good? Or is it better that you feel like people don't judge you or feel that you are the responsible party? You have to kind of think that in.
Great point. Yeah, especially with custody, right? Family court.
Yeah.
He wasn't at my house that day when he did this. I see that in my section with my kiddos. Yeah.
Definitely. I know people have some questions about what is the parent's responsibility when a child is 17 and a half and attempting to get help for substance abuse. I'm going to jump in real quick on that one. I know 17 and a half, we as older adults say, that's not grown, that's you're still a kid. They legally are considered almost adults, and they have a lot of abilities to kind of say what they want to do, whether they're going to go to treatment, whether they're going to go and get help. I have a lot of parents who say, well, they're going to be 18 and then I won't be able to do anything for them. That's a possibility. I know what you have to realize is that even a 12-year-old or a 14-year-old, if they don't feel they need help, we can offer them things. It doesn't necessarily mean they're going to respond to it. But we can, obviously we have a little bit more control, but not that much more. And I'll let the panels answer as well.
No, I agree with what you just said.
Yeah, law definitely play a part in that, right? Age limit when it comes to consented treatment in different states, different, like you mentioned, yeah, 17 and a half, 18, it's still not adult, things are a little bit tricky or different when it comes to age and getting treatments, and state laws and regulations kind of play part in that too. So that's something to think about. And sometimes some kids might emancipate themselves. At that point, the parent lost all guardianship or the right to kind of regulate if the person is getting treatment or not. What do you think, especially being a former police officer? Do you ever know?
About which thing?
In Missouri?
In Missouri, yeah, if you're 18 years old, you're considered an adult under the law. You can be charged as an adult and you can make decisions independently of your parents at 18. 17 and a half, I don't know for sure how that works, but I know for sure at 18, there is a legal independence that exists at that age for a kid, even though they are still kids. As you pointed out earlier in the discussion, their brains are not fully developed till they're 25. But the law doesn't necessarily operate with the recognition of that. So,
yeah, it just varies. It's weird when it comes to stuff like that, especially 17 and a half, and a child who already have emancipated themselves. So just create that safe space and meet them where they're at, and just try to do the best things for their interest in order to get them into a treatment. So it just comes down to the communication styles and different things. Creating that safe environment for them so they can feel like, I do need the help and I am going to go to treatment.
The best thing you can do in this entire situation is have a good relationship with your kid. And that's sometimes easier said than done. I fully understand that. Even when we put effort in, it's sometimes easier said than done, but keep trying. Because to the extent that you have that connection and that open line of communication, and you are a safe space for them, the options that you have to really address a crisis like this are expanded. Whereas if you don't have those lines of communication, those options get contracted and become fewer and fewer.
Yeah, you might have to do some interventions, some family therapy, individual therapy. You know, the help is there. Definitely seek help if you feel like you need it.
We've been some great questions. I think both panelists agree that one of the big things, and both of you have said this, is the relationship you have with your kids and being ready to listen. Definitely is one of those things where substance abuse obviously has been here for a long time, since, you know, people long before they were even using marijuana and things like that, people found ways to use drugs. So it's not going to end because of one thing, but it's obviously something that we can address better now than we could then. I know that we have we are kind of running a little bit over time. That's my fault. I was all into it. I was getting into it. I was ready to.
You get lost. The topic is well need to be discussed and talk about. So yeah, as a counselor, you just want to.
Maybe we can do a part 2 one day.
Definitely. We answered most of the questions in the chat, but one that came up, and it was kind of interesting. On college, kids going to college, especially parents, what's the best approach when a parent notices when they return home and they may have been using drugs? I'm gonna let you guys answer. That's a good one. I'd love to see what you come up with.
It's the same. I hate to sound like a broken record, but it's the same. It's a conversation. Yeah. I've built that relationship over time. Now I have a young adult who I have open lines of communication with, and we can talk about what's happening, what's going on, what have you been exposed to, what have you been up to, and take the conversation from there and continue to support that individual and direct them towards making the best choices that will allow them to fulfill their potential physically, mentally, and emotionally.
Yeah. I mean, if they are using on campus, most likely they're going to be using while they're home on holiday or vacations. They're going to be using, and you can kind of look for that key signs when it comes to the physical or behavioral attribute in order for you to see that if they are using or abusing the substance. So those are different things. And then it go back to that communication piece, right? Having direct conversations, holding them accountable, making sure that you're not enabling their behavior. Sometimes that can be very hard and difficult for some parents. No parents want to admit that, oh, my child is using substance, or my child have substance use disorder or mental health. So those are things that you have to think about, and accountability definitely have to be there.
Okay.
Cameron?
We actually have a audience poll question that we're going to pop up onto the screen. There are 2 questions, so it's very short. Jeffrey, if you would mind popping those up. Jeffrey?
Yes, I don't know. I think people answered it. Did you share it before? I see.
No, the 2 questions.
Okay,
After this, would you interact with children differently as it relates to substance abuse?
okay, let me see. One, yeah, it's coming up.
Okay.
Let me know if, is there?
Yeah, there it is. So the two
Okay.
questions are, one is, after this webinar, would you interact with your children differently as it relates to substance abuse? Please answer yes or no. And then the second question was, does discipline of children as it relates to substance abuse vary based on which country or religion one holds in Africa? That could be a conversation.
Of one.
Yeah, all on its own.
Yeah.
So go ahead and answer yes to those questions. And then once we have the responses, I get while people are answering that with our panel, I wanted to thank you very much for your contribution. Thank you for spending your evening with us and giving us the insight of your vast experience. I think we've answered most of the questions, but we might have a couple of people who have some any extra questions, and I can read them out if you don't mind staying on for a little bit. And once we do the poll questions, if we have any wrap-ups, we will go ahead, and then I'll let Jeffrey close out.
Yeah,
people
it
have
was-
already asked if you all would come back for part 2, so we have to bring you back
Thank you for
sometime.
having me.
Yeah,
It was a honor, especially, you know, the culture I come from, you know, and also as my religion. So this is definitely do impact us. It definitely do affect, you know, people from Africa, Muslim person. When I think about it, mental health and substance use does not discriminate. I always tell my client that.
No.
It don't discriminate against gender, race, ethnicity. Anybody can have addictions. Anybody mental illnesses, and it varies across race and genders and ethnicity. So yeah.
100% correct. Absolutely right. We had one of our drug counselors make the statement talking about a person that they were counseling, and the person made the statement to them, but I don't even want to use drugs. And the counselor told them, but the drugs want to use you. So the least exposure that you can have to it, the better in terms of addiction to serious drugs. And I'm just glad to be part of this conversation. I'm glad that, you know, somebody thought enough of me. I think it was Anastasia Wright to reach out to me, and Giselle, you brought me on, and I'm glad to be part of the discussion.
Definitely, I want to thank my Link sisters, Giselle Marcus and Nanette Baker. They are the International Trends chairs, co-chairs, and they are they do wonderful things all the time. Both of them are in the field, and they're lovely ladies. So I do appreciate you both for bringing this all and helping to bring this all together, along with Jeffrey and Nintendo for Africa. Are there any other questions that we might have missed that anybody wanted to answer? I think I incorporated most of them into the conversation or the discussion. Or are there any specific questions for either of our panelists?
Sometimes there is the debate in the field pertaining to genetic and environmental factor, right? The term they use is nature versus nurture, right? Kind of concept. Some clinicians or researchers do believe that genetic or gene do kind of play a part in that. Especially with some study have shown that 50% of people who have, you know, family history or substance abuse tend to engage or is likely to engage in the substance use abuse themselves on a child or adolescent. And there is the flip side of that, some researchers or clinicians say that no, genes and genetic don't have any part in there. This is more of environmental influences can kind of play part in that. Some of the stuff that we have already discussed, such as parenting, the environment, peer pressure, media influences, and something like that. You know, I just want to kind of touch base on that a little bit, because sometimes that is some things that parents or It might be some lingering questions. I am one of the counselors that I believe that it can be both of them actually. Both can contribute to substance abuse or substance use disorder in child or person. It can be genetic at time, or it can be environmental, or it can be combinations. It just all depend and vary. And sometimes you can have a child that do kind of have the two factor and they don't even use substance at all. They don't engage in substance use or substance abuse. So I know sometimes some parents do have questions about that.
Okay. All righty. I'm going to let Jeffrey close out the event. He has some exciting news about some other things that are going to be taking place for Vintendo for Africa. And Jeffrey.
Thank you so much. Thank you so much, Claudine, Redditt, and Haja for that
Thank
great
you.
conversation.
Thank you.
I think there's somebody who was asked, I don't know if it's you have a minute to say, when a teenager, 15 years old, comes home from school and you notice he is using drugs, what is the best approach? Just so that was sent on my inbox, and I wanted to see if anyone can say something shortly.
I'm sorry, can you repeat the question?
When a teenager, 15 years old, come home from school and you notice that he is using drugs, what is the best approach?
Yeah, and you already noticed those, behavioral, physical signs that they are using substance. Definitely create that safe space, meet them where they're at. Don't come from a judgmental standpoint, remain calm and collective. A lot of time in the African homes or a different culture of different ethnicity, automatically reaction is to be reactive by yelling, screaming, or yelling. That's definitely not gonna make the child admit or have the honest discussions that it need to be set into place in order to seek the help and get them into treatment. So remain calm and collective, have that open-ended question, discussions, and be direct with them. The term I would use, don't go running around the bush, just be direct with it if you notice those signs like that, because the goal is to get them help and the treatment that they need.
Right. I think that's put very, very well. One of the things I like to have conversations with, especially young parents. I'm thinking of a young man who's got a very young daughter right now, and I see his emphasis is on discipline, discipline, discipline. And what I want to tell him, and it relates to this question too, is, man, you don't want to be the thing that scares your daughter. You want to be the place she comes to when something scares her. You don't want to be the crisis. You want to be the place that your kid can come to in crisis, if that makes sense. Mm-hmm. And yeah, definitely create that safe space, meet them where they are, and listen. And then see if you all can identify a way forward that's going to lift that kid to his or her best self.
That's good. I appreciate that. That's a good feedback. And thank you so much. I want to give a minute to Sarah, maybe say something about the things that you're doing in New Jersey, and also Rose, and then we'll wrap it up. Thanking you, Sarah, for the great work you've been helping us tonight.
Oh, thank you, Jeffrey. My name is Sarah Mulele. I am in New Jersey, and I work with an organization called EPARD. And our focus is to support youth and young adults. We meet for events like this and other events that affect their life, in high school and college, including supporting them, to find internships, jobs and stuff like that, just to help them out. So we are located in New Jersey. However, we do some of our events are virtual. And so when we have them virtually, they are countrywide and even international. But for the most part, we also meet in small groups. Thank you so much. I am so excited for the talk, the panelists tonight, and all that you have been able to share. This is great. It's a great topic that many of the parents are having challenges, and it's a real problem that many of African descent, recently immigrated parents are having, because it's a new way of living, and we are seeing face drug issues with our kids. And so having conversation like this, it's great for the parents so that we can continue to be able to support our kids. So thank you, Jeffrey, for the work that you're putting, and we look forward to the event that you have for our youth on October 15th. Thank you.
Thank you, Sarah. Appreciate it for the great work you're doing and also for helping us tonight. Is Rose there from Florida?
Yes.
Yeah,
Thank
go ahead.
I want to thank all the panelists, and you guys did a great job. This is a very touchy topic to parents and young people. I am a leader of, or a founder of nonprofit known as IHOPE. IHOPE stands for International Health Operation, Patient Education and Empowerment. And hence, what you guys were discussing is dear to me because it's healthcare awareness. Many people do not realize that this is a crisis, or if they do, they don't know how to handle it. And many parents find it very hard to focus on this. So I want to really acknowledge what you guys have done. And of course, I believe, Mr. Jeffrey, you're doing a great job on this. You might bring part 2 and 3 following. And if you don't, then I might look for them to do another section with IHOPE, because it's amazing. It's a one that many a times young people ask for, actually, and parents want to know more, and they don't know what to do. And we cannot assume that we are experts on this. We might know a little, but you guys are the best that can actually help us, especially Mr. Redditt. How you put it makes people have their eyes open and say, whoa, okay, what next? So I want to really appreciate you all.
Thank you.
Yes, thank you so much. We work globally. We are an international group. We work in Florida, basically. But because of the global aspect, we are able to reach all corners of the world. So we do a lot of our online stuff. Hence, if we call on you, we know you're going to reach over 20 and 30 young people, 1,000 young people, and of course, their parents. So this is a huge, huge welcome topic. And we believe one at a time will be helped. Our goal is always one step at a time, one young man, one young woman, one young parent or old parent will get some message and pass it on. So we have to face it head on, and we have to be accountable.
If you're down there in Florida, we're going to pray for your safety and well-being. We've been watching the news, and all we see is that Hurricane Ian has come down there and done some serious damage. So I hope that you're in a safe place, and thank you for your kind words.
Thank you, thank you. Yeah, we are fortunate. Yes, we were in Tampa. The eye was come to our end, but somehow it did not that it did not affect other sections. Actually, it did bad. But thank you so much for that. All right, and you're welcome, guys. On November 5th, we have a program that is set. It's a gala, and it's what you have on my my picture, my profile there. We are welcoming anyone. We shall have a section online. It's gonna be like hybrid. And if you've been in Tampa, there's a Yibo city. Yibo is historical center that covers a lot. We welcome you all there to enjoy yourselves and learn more. We have 5 speakers, and one of them is also gonna deal with the same thing that you're talking about here. So it's something that is dear to me. Thanks again.
Thank you, Rose. Thank you so much for also the great work that you're doing and also for the great partnership. I don't know if there is anybody else that I have left out who maybe is doing something similar to what the 2 Rose are doing, and Sarah may want to let us know, because we may have all the network of people, other places we can always recommend them to attend your forums. Anybody out there that has something? Great. Thank you so much. I think because of time, I would say thank you so much for that great conversation tonight. I want to share with you about the upcoming events. I think that was our topic today. Then tomorrow, we have a forum at 6 p.m. and this is on the topic of we're making our way in America. We have a group of mentors from different backgrounds who want to share their experiences. Sometimes we can talk to people until they sit down and somebody who can be able to talk and share about their experiences. That sometimes you're able, the best way maybe to help many of our young people make a better decision. So tomorrow we'll have a meeting. It's going to be in-person meeting. We're trying to mix both in-person and virtual, but then tomorrow, if we try to see if an opportunity opens that we can be able to stream it, will be good. But I think it's the address is right there. And then on April the 4th, which is next week on Tuesday, we all know all these great skills, trade skills and jobs that are applying for people that you don't necessarily have to have your 4-year degree, but there are great opportunities, career people able to build career as programmers, as CDL drivers, construction. So we have these companies coming to speak to us. It's going to be in-person meeting at JFK Community Center. I think there is a link there. You can sign up, but it's just you coming around 11 a.m. we'll be there up to 2 p.m. And then on the spec of idea of helping our young people to know their identity and who they are, we have a cultural night, which is on next Friday, where we'll be showcasing different arts and also our African culture. We have a group of African dance, which it's Africa Performing Arts. We have a group of our community that have been doing a lot of African dance and drumming. Please come, and we'll be able to showcase also some African food. And then our annual gala, big event that we always come together to meet and know each other, but also celebrate the work that you all have been doing in the community. Please purchase your ticket. If you are not able to attend, sponsor somebody. If not, you can just donate. But also for those who are businesses, this is a great opportunity for you to promote and advertise. You can sponsor a table for your group, or you can just register as a sponsor and you'll be able to blast your business. And then talent night, again, same way we're trying to keep our young people busy and engaged in a productive way. It's going to be on December 18th. Last event we had was very, very successful. We were so impressed to see how much talent they have. And we want to nurture those talents where they can be able, if they can build a career out of it, it's perfect, but basically keeping them away from the trouble. I mentioned that we have this topic for the youth on Saturday during our monthly meeting on October the 15th. We will be able to share that information there or update it on the website. And then we will also have another one coming up in November again. But I think I posted on the chat there, and I think Haja may have mentioned that there is a mental health first aid training that is going to be on Saturday the 17th, October the 17th. It's a great training for you as a parent, and also if you work with young people, if you have, it's between the age of 12 to 18, but I would recommend anybody who has a kid, it's a good way to get yourself equipped. When that time comes, at least you will be ready to know how to do and how to handle the situation. Other than that, I said, thank you so much for your great support and being with us all this time. We will invite you again for the next part 2. I hope when we reach out to Mr. Redditt and Haja, you will be available and be able to continue with this conversation. Thank you so much, Claudine, for your great support and great moderating tonight. We appreciate you, and let's keep on the ball rolling. Let's keep on educating our community and educating ourselves.
Thank you. I do have a question, Jeffrey. Do they have our contact informations?
That's good. Are you able to share it on the chat there?
Yeah, let me do that real quick before we conclude.
Yeah, if somebody want to reach out, I think that would be good. They can share with you.
Absolutely.
So
that's
Let's see.
website and my cell phone number in case you do want your child to get access for our ID program.
yeah,
I can just put my email on there.
that'll be awesome. That'll be awesome. And let's keep on getting this information. Let's keep on logging this information. You don't want to wait until a situation finds you and you are like, I need to find information. You'd rather have this information and never use it than be in a situation where you need it and you don't have it. So let's keep on educating, but also importantly, share. Let's be generous information. Have this conversation with your friends, and hope we can be able to upload this recording and you'll be able to share. Even if you attended, you can always listen to it and add more information about it.
Please don't hesitate to reach out. The help is there, the resource is there. Don't feel shame, don't feel embarrassed, because a lot of time culture kind of play that part. Definitely seek help.
Great. All right, thank you so much. I will hold on just in case somebody, so you can be able to get all their contacts there.